Did you know that in 2022, 10% of the world's population was aged 65 years and older? And did you know by 2055 this is expected to rise to 16%, and by 2100 to 24%? The aging population is moving into assisted living and long term care facilities at an increased rate. As the aging population continues to grow within Canada, falls have become the leading cause of admission into these homes and the leading cause of hospitalization and injury. Canada spends approximately $2 billion on healthcare resources to manage injuries from falls annually. 50% of residents in long term care will fall at least once annually, and 40% will experience two or more subsequent falls within the same time period. Falls are a serious concern. They may result in functional impairments and pain, and significant consequences to a resident's quality of life and independence. The aging population already has an increased risk of falling, but this further increases with the presence of cognitive and visual impairments, dementia, and frailty. These factors increase the likelihood of falls and further accentuate the need for providing long term care homes with effective strategies to prevent them. So, how do we manage this issue? Exercise based interventions. Evidence demonstrates that the use of exercise interventions that consist of strength training, gait training, and balance training will provide a positive impact on preventing falls. Furthermore, incorporating these exercise interventions into regular routines not only prevents falls, but improves the overall physical health and mobility of these adults. How do we implement this? We start by identifying the residents who would be appropriate for such interventions. These residents will be assessed using the Rapid Assessment Instrument Minimum Dataset, or the RIMDS tool, and will be invited to participate in the study if they qualify. This includes residents who are 65 years and older, who've endured a fall or multiple falls within the last 30 to 200 days of living in long term care, and who meet the other requirements for inclusion. Residents who do meet these inclusion requirements are invited to participate and be provided with the information regarding the purpose, procedure, and any risks and benefits involved. These individuals will make up the experimental group, whereas individuals who fall under the participation requirements but ultimately refuse to participate in the intervention will be used as a control group. Consent will be received in both written and verbal means for both groups. The intervention will span across 3 months, and during this time, the experimental group will participate in structured exercise programs led by physiotherapists and kinesiologists. The structured nature of the program will ensure a comprehensive approach to improving balance, strength, and mobility amongst the participating residents, which maximizes the potential for reducing falls within the time period. Each session runs for 1 hour and is conducted 3 times a week. The results from the experimental group will be compared to the control group, and the analysis of this information will provide helpful insight into the effectiveness of balance training exercises in reducing or preventing falls amongst residents in long-term care.